Hello, I'm Dr. David Greene, CEO of Preferred Pain Center here in beautiful Phoenix, Arizona. Today I'm at the Phoenician Resort, which is a beautiful 5-star resort here in the Phoenix, Scottsdale metropolitan area. Right in this hubbub, which is right next to the Scottsdale Fashion Square Mall area, which is one of the 20 largest malls in the country, you have this beautiful oasis, which is over 240 acres of pristine, lush tropical foliage. You have 1.5 golf courses, 11 tennis courts, a beautiful well-being spa, 9 pools, 643 guest rooms, and multiple restaurants, from 5-star, down to the grill for the golf course. The resort was finished in 1988, so unlike the Arizona Biltmore Resort, which is a few miles away, that was finished in 1929, you don't have 80 years of history, but you do have a lot of history. The visionary and founder of the resort was Charles Keating. So when you're at the resort, you really don't think about the savings and loan scandal, but that's actually when it was being built, right in the mid to late 1980s. The topic for today is sacroiliac joint injections, commonly known as SI joint injections. The SI joint is a common denominator for a lot of arthritis, pain, and debilitating problems for patients as they age. There are 2 of them, one on either side below the low back in the buttock area, where the ilium, which is part of the pelvis, meets the sacrum, which is the area that's attached to the lumbar, the bottom of the lumbar spine. So it's an irregular joint, kind of jagged. It's not a linear joint. There's a little bit of movement in it every time that we walk and move, maybe microns, millimeters, not like a ball and socket joint like a hip. Okay, so there is some movement. And where does arthritis pain come from? Movement. That's why we give knee braces or splints for the first the thumb. When there's arthritis in the first CMC, those types of things help decrease pain. But you can't really do that in the sacroiliac joint, right? I mean, it's sort of not in an area that's prone to good bracing. So what are the treatments that help with sacroiliac joint? Well, anti-inflammatories can help, as well as Tylenol, and maybe for acute situations, a low-dose narcotic. Chronic narcotics, bad idea. Well, how do you know if you have a sacroiliac joint problem? Well, just getting an x-ray to show that you have arthritis or a problem there is not indicating a definitive problem. You really need more. A physical exam that's complete and comprehensive can help, because there are some provocative maneuvers that can help stress that joint and tell you if there is a problem there. So if there's suspicion, the next step would be some mild treatment, and then potentially an injection. A pain doctor, of which we have board-certified fellowship-trained doctors at Preferred Pain Center, can do an injection into the sacroiliac joint of numbing medicine along with some steroid, cortisone, that can do 2 things. One is it can tell you diagnostically if the pain is coming from that joint. How? Because it relieves pain, if it is, and if the injection is placed appropriately. Which brings me to the next point of the pain doctor should do the injection under fluoroscopy, which is X-ray real-time guidance. Why? Because, like I said, it's not a linear type of joint. It's a little bit jagged and irregular, and there's some angles to it. So you really need to use the X-ray machine to make sure you're getting into the proper space. It can be tricky. The second thing is, not only is it diagnostic, it can be therapeutic. It can help relieve pain. It can help do that for weeks or months. So if it does that, then 1, the patient's going to be better off because they're going to have relief of their pain. But 2, they'll know when the pain recurs, and usually it will because the arthritis doesn't just go away. They'll be eligible for one of 2 options. 3 options, really. There's always the option to do nothing. But one option would be to have the injection repeated. It worked the first time. Why not have a second one? It's outpatient, very low risk of infection or problems. And if you're using steroid intermittently over a period of a few months, 3-4 months later, by and large, it's okay. And another option would be radiofrequency ablation. Radiofrequency ablation, I've written articles and done videos on that before. It's basically heating up the area around the joint to deaden the pain coming from the tiny little nerve endings that supply that joint. If you can do that, you can deaden pain for, studies have shown in the low back, year and a half. Very effective pain relief for a long duration, avoiding surgery. And there really is no surgery for sacroiliac joint pain. So what are you going to do? Well, the medication, maybe some physical therapy, some chiropractic treatment, the nonsteroidals, but the injection and then the radiofrequency ablation can be great. At any rate, a lot more information on our website at preferredpaincenter.com. Also, we have a blog, preferredpaincenter.com/blog. There's educational videos, animations, there's testimonials on our website. So check it out or call us today at 602-507-6550. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.